Hello everybody. Many of my students ask for the first time, sir, we need to prepare for NCLEX or an exam and other competitive exams. So please post video related to NCLEX or an exam, how to prepare, and they ask some solved questions which will help them to appear in lot of competitive exams. So I agreed to their request, and today I decided to make a video which will guide the student for preparing NCLEX or examinations. For this, what I decided, I took Saunders 4th edition NCLEX or an examination book, and based on that book, I formulated my questions, and these questions will help the students to give their exams very effectively in any kind of competitive exam which will held in India and in abroad. So I decided to go chapter wise. For the first video session on NCLEX or an examination, I took chapter fluid and electrolyte balance. In that 20 questions are there. Out of 20 in this video, we are giving 10 questions, and another 10 questions will be explained detailedly in the second video, which will be benefit for you to give any kind of competitive exams. Let's go for today's class. The first question: a nurse is reading a physician's progress notes in the client's record and reads that the physician has documented insensible fluid loss of approximately 800 ml per day. The nurse understands this topic of fluid loss can occur through option A, the skin, option B, urinary output, option C, wound drainage, option D, gastrointestinal tract. So read the question carefully and see the options given below. What will be the answer to this question? So read the question again. A nurse is reading a physician's progress notes in the client's record and reads that the physician has documented insensible fluid loss of approximately 800 ml per day. So note here insensible fluid loss of approximately 800 ml per day. The nurse understands this type of fluid loss can occur through the skin, urinary output, wound drainage, and option D is gastrointestinal tract. So how we find out the answer? We must know the rationale for our answer. First of all, what is sensible loss and insensible loss? Sensible fluid loss occurs through wound drainage, GI tract losses like vomiting, and through urination when there is excess amount of urine output, and also insensible loss of water from our body. The patient is well aware about it. In contrast to that, insensible loss occur without the awareness of patient. For example, when water loss is occurring through skin and lungs, when there is excessive perspiration or when there is excessive breathing, when breathing rate, we lost more amount of fluid. Such loss is unaware to the patient. That is called as insensible loss. So fluid loss through the skin cannot be measured accurately and approximately, whereas option B, option C, option D, the loss of fluid through urinary output, wound drainage, gastrointestinal tract can be recorded accurately and approximately. So here the answer will be option A, the skin. The amount of water loss through skin is insensible. This we have already studied in physiology. Now we move on to the second question. A nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk of deficient fluid volume. So here a nurse is assigned to care group of clients, and the nurse is reviewing the client's medical record the nurse determines that which client is being risk of developing fluid volume deficient. There are four types of clients: client with colostomy, client with congestive cardiac failure, client with decreased kidney function, and client receiving frequent irrigation. So here you must know what are the causes of fluid volume deficit. Fluid volume deficit can be occur through vomiting, diarrhea, conditions that cause increased respiration, the conditions which increase our urinary output, insufficient IV fluid replacement, draining fistulas, and presence of an ileostomy or colostomy. So these are the various causes in which there will be fluid volume deficit. You can see the option B, option C, option D. The client with congestive cardiac failure, or the client who have decreased kidney function, or the client who receiving frequent wound irrigation are at the risk for developing fluid volume excess. So by keeping these three in our mind, we can select option A. Client with colostomy is the right answer for question number 2. Now move on to the third question. A nurse who caring for a client who has been receiving intravenous diuretics suspects that the client is experiencing decreased fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? So here the question tells clearly that a nurse is carrying a particular client, the client is under intravenous diuretics. Also, the nurse suspects that client is having decreased fluid volume deficit. What assessment she will take to find out the client is having fluid volume deficit? You can see the options: lung congestion, decreased hematocrit, increased blood pressure, decreased central venous pressure. According to the option given below, we see that the assessing client with deficient fluid volume includes increased respiration or heart rate, decreased central venous pressure, weight loss, poor skin turgor, dry mucous membrane, increased hematocrit volume, and altered consciousness. So these are the conditions in which there will be fluid volume deficit. Again I tell you, increased respiration and heart rate, decreased central venous pressure, weight loss, poor skin turgor, dry mucous membrane, increased hematocrit, and altered level of consciousness. Normal central venous pressure is between 4 and 11 centimeter of water H2O. A client with dehydration will have low central venous pressure. Now you can see the option number 1, lung congestion, option number 2, decreased hematocrit, and option number C, option number 3, that is increased blood pressure. These are the conditions, these are the signs and symptoms in which the patient will have excess fluid volume. So omit first three options, and the answer is decreased central venous pressure. When central venous pressure is decreased due to fluid volume deficit. Now let's go to question number 4. A nurse is assigned to care for a group of clients. On review of the client's medical record, the nurse determines that which client is at risk for excess fluid volume. So again the nurse is carrying a group of client, the nurse is reviewing the medical record of the client, the nurse determines that which particular client will be having risk for excess fluid volume. The options given below: the client taking diuretics, the client with renal failure, the client with ileostomy, the client who requires gastrointestinal suctioning. So here excess fluid volume causes includes decreased renal function, congestive heart failure, the use of hypotonic fluids to replace isotonic fluid loss, excessive ingestion of sodium, excessive irrigation of wounds in body cavities. So these are the various causes of excessive fluid volume. But here the client taking diuretics, the client with ileostomy, and the client who require gastrointestinal suctioning are at risk of deficient fluid volume. So what we need, which client is at risk of excessive fluid volume? So the answer is the client with renal failure. Option O, option number A, option B, option C. Sorry, option A, option C, and option D. The client taking diuretics, the client with ileostomy, and the client who requires gastrointestinal suctioning are at risk of fluid volume deficit. So choose the answer B, the client with renal failure, having more chance to develop excessive fluid volume. Question 5. The nurse is caring for a client with congestive heart failure. On assessment, the nurse notes that the client is dyspneic and that crackles are audible on auscultation. The nurse suspects excess fluid volume. What additional sign would the nurse expect to note in the client if excess fluid volume is present? So what are the signs of excessive fluid loss? So what additional sign would the nurse expect to note that if the client is having excessive fluid volume? Okay, now we see that when the nurse is seeing the client with cough, dyspnea, crackles, tachypnea, tachycardia, and elevated blood pressure, bounding pulse, and elevated central venous pressure, increased weight, edema, distended vein in neck and head, and decreased hematocrit volume are the signs and symptoms of excessive fluid volume. So, weight loss, flat neck and hand pains, and decreased central venous pressure are the symptom of fluid volume deficit. When there is excess fluid volume, there will be increased blood pressure. So here answer will be blood pressure increase in patient is the signs and symptom apart from crackle sound for patient. The next question number 6. A nurse is preparing to care for a patient with potassium deficit. The nurse reviews the client's record and determines that client was at risk for developing potassium deficit because the options are the client has renal failure, requires nasogastric suction, has a history of Addison disease, and in taking a potassium sparing diuretics. So read the question carefully and choose the correct answer. So the nurse is preparing to care for patient with potassium deficit. The nurse reviews the client's record and determines that client was at risk of developing potassium deficit. Which client among these 4 clients, which client is having the risk of developing the potassium deficit? So how to answer this question? Potassium rich in gastrointestinal fluids. Potassium is more high in gastrointestinal fluids and these are lost through gastrointestinal suctioning. When the patient is undergoing GI suctioning, more amount of fluid from the stomach will be gone outside. Automatically, potassium will be deficit. Okay, the client with renal failure, Addison disease, and the client taking potassium sparing diuretics are at risk of developing hyperkalemia, that is increased potassium level in blood. So you leave the option A, option C, option D. These three options are related to hyperkalemia, that is increased potassium level. So our right answer will be the client who requires nasogastric suction. Okay, hope I am very slow and you all are understanding my lecture without any difficulty. If you have any difficulty in understanding my lecture, you see the video twice, thrice according to your capacity. You will able to get it very easily in fast manner. Now move on to question number 7. A nurse instructs a client at risk for hypokalemia about the food rich in potassium that should be included in the daily diet. The nurse determines that the client understands that food sources of potassium. If the client states that food item lowest in potassium is option A apple, option B carrot, option C spinach, option D avocado. So in this four fruits or vegetable, which one is having low potassium content? Let's see that. When you see the apple, medium size apple, it gives 159 milligram of potassium. When you go for a large piece of carrot, which gives 341 milligram potassium. In case of spinach, 3.5 ounce, that is uh, 3 3.5 ounce of spinach provides 470 milligram of potassium, and a medium size avocado provides 1097 milligram of potassium. So in all the four options, avocado gives higher amount of potassium to patient, spinach next, and third is carrots. The option which we want to choose is apple because it gives only 159 milligram of potassium. So answer apple. Question number 8. A nursing student needs to administer potassium chloride intravenously as prescribed to a client with hypokalemia. The nursing instructor determines that the student is unprepared for this procedure. If the student states that which of the following is a part of the plan for preparation and administration of the potassium. So the instructor after seeing the student's statement comes to a conclusion that the particular nursing student is not ready to administer potassium chloride. So we want to choose which statement the student would have told, which make the nursing instructor understood that student is unprepared for administration. So statement number 1, obtaining a controlled IV infusion pump. Second one, monitoring urine output during administration. Option C, diluting in appropriate amount of normal volume. Option D, preparing the medication for bolus administration. Let's see the answer. This you need to listen very carefully. Detailed explanation for all these things will be given here. Potassium chloride administered intravenous most often we should dilute it in IV fluids and we should infuse via pump or controller. The usual concentration of intravenous potassium chloride is 20 to 40 milliequivalent per liter. So usual dose what we give potassium chloride is 20 to 40 milliequivalent per liter. Potassium chloride is never given by bolus. It's nothing but IV push. Giving potassium chloride by IV push can cause cardiac arrest. Usually, potassium chloride is diluted in normal saline solution and dextrose solution is avoided because this type of solution increases intracellular potassium shifting. So usually we give the potassium chloride diluting with normal saline. We will not go for dextrose solution because it increases intracellular potassium shifting. IV bag containing potassium chloride is gently agitated before hanging. The nurse should agitate the potassium chloride containing IV bag slightly, gently, and then only it should be hanged in IV stand. IV site is usually monitored closely because potassium chloride is irritating to the veins and the risk of phlebitis exists. So when we give potassium chloride through intravenous route, the chances are more for inflammation of vein, which is called phlebitis. The nurse also monitors urinary output during administration and contacts physician if the urinary output is less than 30 ml per hour. So these are the detailed rational explanation for each option. So by know that the student is saying that he is going to prepare for administering potassium chloride through bolus, that is IV push. We know that it is a contraindicatory method of administering potassium chloride. So we have already seen when we give potassium chloride in IV push, it can cause cardiac arrest. So we should not give potassium chloride in bolus form. So the answer is preparing the medication for bolus administration. Okay, now let's come to the ninth question. A nurse reviews a client electrolyte laboratory report and notes that the potassium level is 3.2 milliequivalent per liter. Which of the following would the nurse note on the electrocardiogram as a result of the laboratory value? So the nurse is seeing the laboratory report of the client, and in that the potassium level is 3.2 milliequivalent per liter. Also, the nurse want to see the electrocardiogram report, and the nurse can find out this is due to this particular interpretation in electrocardiogram is due to the high potassium level. So options given are U waves, absent P waves, elevated T waves, elevated ST segment. So how we choose the right answer? Serum potassium level lower than 3.5 milliequivalent per liter indicates hyperkalemia. So above 3.53, that indicates patient is having hyperkalemia. In case of potassium deficit, what will be the findings? Potassium deficit is common electrolyte balance and is potentially life threatening. In such case, the ECG interpretations can be done: inverted T waves, ST segment depression, and prominent U wave absent. This you have to note: prominent U wave absent in case of deficit, potassium deficit. Also, the P waves are not the characteristic of hypokalemia. But here, what are the things present? Here, the potassium level is 3.2 milliequivalent per liter. Okay, and here the options: absent P waves, absent elevated T wave, and next one is elevated ST segment. These three options are as a result of what we call as deficit. But here potassium level is higher, hyperkalemia. In this case, the patient having prominent U waves, and the patient will have prominent U waves. Uh, yes, prominent U waves you can see in the patient electrocardiogram report. Again, I tell you, the potassium deficit is common electrolyte balance and is potentially life-threatening condition. So in such case, ECG changes include inverted T wave, ST segment depression, and prominent U wave. Absent P waves are not a characteristic of hypokalemia. So according to this interpretation, the answer is appearance of U wave. Hope you clear with this. We go to the last question of this video. A nurse caring for a group of clients reviews the electrolyte laboratory results and notes a potassium level of 5.5 milliequivalent per liter on the client's laboratory report. So patient is having hyperkalemia. The nurse understands that which client is at high risk for development of potassium level at this level. So different clients are there. Clients with colitis, clients with Cushing syndrome, client who have overusing laxatives, and client who have sustained traumatic burns. In this four type of client, which client will be at risk of developing potassium level excess? Okay, now we will see the right answer. A serum potassium level higher than 5.1 milliequivalent per liter indicates hyperkalemia. So hyperkalemia, when the potassium level is going above 5.5 milliequivalent per liter, the condition is called hyperkalemia. Client who experience tissue excessive, massive cellular destruction such as trauma, burns, sepsis, metabolic or respiratory acidosis are at risk for developing hyperkalemia. So here the hyperkalemia can occur due to traumatic burn. In traumatic burn there will be massive cellular damage. When you see the client with colitis and Cushing syndrome client, or the client who has overusing laxatives, they are prone to develop hypokalemia. So we can come to a conclusion that the client who has sustained traumatic burn will be at a risk of developing hyperkalemia. Hope this first video of NCLEX RN examination preparation you get benefit. If you have any problem, you can comment in the box given below. If you need any suggestion to improve this kind of lecture, you can comment, and please subscribe to our nursing channel, Satu Carry online nursing channel, and in next video we will continue the remaining 10 questions related to fluid and electrolyte balance. Hope you understand.